We are back here on Healthy Living. Again, Dr. A has joined us, and we're going to be talking specifically now about some of the techniques that you do. One in particular that you wanted to share with us today.
So we wanted to talk about the Watchman procedure. It's otherwise known as a left atrial appendage occlusion procedure. It's used predominantly in patients that have atrial fibrillation, a rhythm disorder in the heart.
Okay.
Which is very common in many places. It's more common where we might find some older folks. As we all get older, there's more atrial fibrillation. That's right. But it's also common in younger folks as well.
What is it?
It's a rhythm issue with the heart where it causes a very chaotic, irregular rhythm in the top portions of the heart, in the top chambers of the heart.
What would I feel? What would I experience?
Well, you might feel nothing, unfortunately, and then it comes with its own issues. But most patients, when they have symptoms, they'll feel some palpitations, skipped beats, rapid heart rate. They might notice that their blood pressure monitor is having trouble giving you a good blood pressure because it can't track the beats of the heart.
Is it just an erratic beat?
It's very erratic. It's chaotic. Instead of beating 60, 70, 80 times a minute, your heart might be going 120, 140.
Would it ever be confused with like an anxiety or something like that?
I suppose it can. And oftentimes what happens is, you might have an irregular reading on your Apple Watch. These days, that's something that brings patients in. They might tell you there's an irregular heartbeat. Go see your doctor, talk to your physician about it so they can get a more definitive evaluation. We can tell more definitively by doing an exam on the patient, talking to them, but also we have other, tests, very simple tests, of course, an electrocardiogram. We can hook them up to a monitor and look at any particular irregular rhythms and heartbeats, check your blood pressure, all the vital signs that we would do anyway. So that helps us a lot, and then we can tell.
So specifically, I've been diagnosed with AFib, here we go. What can I expect as a patient?
All right, so the problems with atrial fibrillation are really twofold if you want to break them down to the basics. Number one is the symptoms, and that's for patients that are going to be symptomatic. The irregularities, irregular heartbeats, palpitations, high heart rates, and those things can lead to just a very uncomfortable feeling in your chest discomfort sometimes. In others, you might feel shortness of breath, fatigue. You can't finish your pickleball game. You can't finish the stairs. You can't carry your groceries in. You can't make it to the mailbox. You end up very short of breath and fatigued and tired, and you don't like it, and then that triggers a call to your doctor most of the time. The other side of the coin really has to do with blood clots forming in the heart.
Got it.
So when your blood is not moving as efficiently in the heart as it is in other times, when you're not in atrial fibrillation, then it increases your risk of forming blood clots in the heart. And from there, those blood clots can go a variety of areas. One being because there's so much blood flow to the head is to your brain. And from there, you can have a stroke or a little mini stroke or a TIA or whatever you want to call it, an issue related to that blood clot potentially leading to your brain.
So I know we've only got a couple of minutes. So we've decided on this Watchman procedure. What will I experience when I am having that procedure?
Well, hopefully what you experience is you talk to us, we're telling you that we give you some sedation, and then you wake up and we're done. We hope that that's really the case. What will happen is we bring you into an area such as this in the cardiac cath lab. We give you some sedation to keep you comfortable. We numb up areas in the body where we need to get in. We put in a variety of very small flexible tubes. And through those tubes, we put a little device. It's the Watchman device. It's the left atrial appendage occluder. That goes in a little outpouching or sac in the heart that's responsible for causing probably about 90% or more of the blood clots in the heart. And once we have it there, once it does what it's supposed to do, after it heals over a matter of 1 to 3 months or so, then you're more safely taken off of your blood thinners, your anticoagulants, so that removes the danger of the blood thinner, yet it protects you from blood clots and strokes.
Is it regulating the AFib, or is that done more medically and this is more?
Great question. It does not regulate the atrial fibrillation. There's other procedures for that. But it will take away the need for a blood thinner.
Which
And
is
there are many patients,
huge.
absolutely, there are many patients which cannot be on blood thinners or find it very inconvenient. There's risk to the blood thinners, of course. Some patients are much more sensitive than others, and it gets to be a real problem. It's a very common issue that we've run into, and this provides an avenue to help.
So the goal here again is to provide some education and information, and you are very excellent at articulating it's exactly what's happening. And frankly, I feel comfortable just listening to what you say. So I'm very grateful that you participated today. Thank you very much. This is your first interview with us.
Sure is.
They're super fun.
Thanks so much.
Thank you. Stay with us. We'll be back here on Healthy Living.